afternoon, and welcome to the second and last day of our 2020 virtual One Health Conference. I am Gwen Sims, the Deputy Director for Harris County Public Health, where we strive to improve the health of our community through innovation, engagement, and equity. Welcome back to those of you who joined us Tuesday, and welcome to those of you joining us for the first time today. We had terrific topics and speakers on Tuesday to discuss how we can work together to harness the power of health equity to achieve good health for everyone, global health challenges we face, and promising solutions. We have another round of incredible discussions lined up for you today with nationally renowned experts to share their insight and perspectives. For those of you joining us for the first time, we have been doing these conferences since 2008 and always in person. I don't have to tell you how the pandemic has changed everything. Instead of canceling the conference, we have learned to adapt to the new normal and go virtual this year. We hope that means it was more convenient for all of you to join us today. Harris County Judge Lena Hidalgo has a brief video message to welcome all of you to our One Health Conference. Let's watch.
Hello, I'm Harris County Judge Lena Hidalgo. Welcome to this year's One Health Conference. First, let me say thank you for your work on the front lines of COVID-19. I know so many of you have been working tirelessly, long hours, often without recognition. We see you, and on behalf of Harris County, thank you for your incredible work, your incredible dedication over so many months, and that I know you're going to keep up as this crisis continues. I'm grateful to the incredible folks that are joining us from around the country. It's a treat and I guess a silver lining of meeting virtually. I wish we could all be in the same room exchanging stories, but we'll celebrate this year's convening with these diverse perspectives and these important discussions. What I admire most about this meeting is that you recognize that the strategic, big picture thinking has to continue even in the midst of a crisis. You recognize that in many ways, the challenges that led us here today are broader structural challenges that we have to tackle in order to get through this, and that we're gonna have to tackle moving forward, so that in so many areas, we're making progress. So I'm eager for the conversations. I'm grateful to you guys for being here. Know that in Harris County, we're working to shift the paradigm of how we look at public health, thinking about health and not just health care, making investments in issues that get at broader social determinants of health, investments in healthy food, investments in addressing disparities. We had the largest investments in environmental protection and response in over 30 years, and seeing gun violence as the health crisis that it is, we're doing everything we can on gun safety. Whatever the issues are, whether it's transportation, whether it's healthy food, whether it's access to a clean environment, or during COVID, equity and access to what is needed, a data-focused response. We are trying to elevate your lessons and to build a smarter response. Another silver lining of us getting together in the middle of all of this is the opportunity to showcase the incredible talent here in Harris County and in Houston. We have all eyes witnessing what we've known, the fantastic research and professionals, whether it is developments for therapeutics on COVID-19, or whether it's vaccine research, or breakthrough cancer research. It's incredible to have the opportunity to showcase these folks, to showcase these advances, and to share that with the rest of the country. So thank you for your work. Thank you for this discussion. Keep it up and enjoy this year's conference.
As I mentioned, Our health department has been putting on a version of this conference since 2008. It actually did not become a One Health conference until 2018. One of the divisions of our health department is veterinary public health, which includes our animal shelter and many other related services. I would like to introduce to you Dr. Michael White, Director of our Veterinary Public Health Division. Dr. White is a veterinarian and has had a big role in the evolution of our conference, and part of his division's focus is on zoonotic diseases, including having a zoonosis veterinarian position on his staff. Thank you for joining us today, Dr. White.
Thank you, Gwen. Again, welcome everyone to the second half of our 13th annual One Health Conference. For all of the veterinarians attending this conference, continuing education credit has been approved for up to 12 hours for attending both days. I know that many of you have joined us each year for several years, and we're happy to see you back again. For those of you that are new to the conference, I would like to give you a little background on its origin. Our first conference, which focused on zoonotic disease, was held in 2008. We've continued to host this conference annually in partnership with Baylor College of Medicine, National School of Tropical Medicine, and Texas Children's Hospital, and attendance has grown each year. Initially, it was geared primarily toward veterinarians and public health workers, and it was called the Zoonotic Disease Conference. Within Harris County Public Health, we embraced the One Health concept, which the AVMA defines as the integrative effort of multiple disciplines working locally, nationally, and globally to attain optimal health for people, animals, and the environment. We wanted to expand this conference to incorporate all three of the disciplines that make up the One Health triad, that being human health, animal health, and the environment. So in 2018, we changed the name of the conference to the One Health Conference to make it more inclusive. The goals for this conference are to unite medical, veterinary, entomology, environmental, and public health professionals to align communication and collaborative efforts across disciplines, to create enhanced multidisciplinary community partnerships, and to address important and relevant issues that affect our local, national, and global communities with One Health principles. Since 60% of infectious diseases, including COVID-19, originate in animals, zoonosis remains a huge component of One Health. And accordingly, our first panel discussion today is titled Zoonotic Detectives, Animals as Ground Zero for Infectious Diseases. So now I'd like to introduce the moderator for our first panel discussion, Dr. Dana Beckham. Dr. Beckham is a fellow veterinarian and the director of our Office of Science, Surveillance, and Technology, which includes the epidemiology group, a group that has been extremely busy for the past 9 months. Thank you for joining us today, Dr. Beckham.
Thank you, Dr. White, for that introduction. Good afternoon, everyone. As Dr. White mentioned, I am a trained veterinarian and a head of the epidemiology and contact tracing group. This group has expanded tremendously during our COVID-19 response. And also, it puts me in a unique position to know the human, animal, and zoonotic part of this equation, and also work with some incredibly dedicated people that are trying to stop zoonotic diseases and prevent the spread of COVID-19. I'd like to take some time to give a shout out and a special thank you to the contact tracing operation. Thank you to those tracers, investigators, epidemiologists, managers, supervisors, team leads, lab task force, and the intake specialists, and everyone that are helping us with this response. So now it's time to introduce the panelists for this session. First off, we have Dr. Jana Mazet. She's a professor of epidemiology and disease ecology at the UC Davis School of Veterinary Medicine and founding executive director of UC Davis One Health Institute. She is the co-director of the U.S. Agency for International Development's One Health Workforce, Next Generation. Now, this is a project that empowers professionals in Central and East Africa, Southeast Asia to address complex and emerging health threats, including antimicrobial resistance and zoonotic diseases. She's also appointed to the National Academy Standing Committee on Emerging Infectious Diseases and 21st Century Health Threats, which was created to assist the federal government with critical science and policy issues related to COVID-19 and other emergency health threats. And I should add that she too is a fellow veterinarian. Our next panelist is Dr. Diana Moreno Santillan. She's an evolutionary biologist interested in understanding the evolutionary dynamics in mammals with an emphasis in host pathogens and interactions. Dr. Moreno Santillan is a postdoctoral researcher for the Department of Biological Sciences at Texas Tech University in Lubbock. Her work focuses on the evolution of longevity and immunity in bats and how these species can tolerate a wide diversity of viruses. Currently, Dr. Moreno Santillan is involved with a project that analyzes bat immunity and coronaviruses. Our third panelist, but certainly he is extraordinary as the other speakers are, is Dr. Scott Weaver. He's the director of the Institute of Human Infections and Immunity, the scientific director of the Galveston National Lab, and chair of the Department of Microbiology and Immunology at the University of Texas Medical Branch in Galveston. It's ranked first nationally among its peers for National Institute of Health funding. He is an internationally recognized virologist and mosquito biologist that focuses on vector-borne diseases such as Zika, dengue, malaria, and chikungunya. So I'd like to take time out to thank all the panelists for being with us today. For those of you that are in the audience, while we're having our moderated discussion, please feel free to put any of the questions you may have in the chat box for the panelists so we can try and answer it towards the end of the session. Since we have many participants that's new to the One Health concept, new to the One Health conference, and to zoonotic diseases, I'd like to just give a brief background to frame the first question for the discussion panel on zoonosis in animals as ground zero for infectious diseases. So that is, animals, they provide many benefits for humans, for us. We interact with animals through our daily lives. We use them as food, fiber, as sporting, as mental health wellness, companionship, and many of us have fur babies that are extended part of our family. But it's important to know that animals can sometimes carry harmful viruses, bacteria, parasites, and fungi that can be transmitted to humans and cause illness. So these are known as zoonotic diseases. It's also important to know that scientists estimate that 6 out of 10 infectious diseases in people can be spread from animals. That's 6 out of 10, 60%. So I'm going to pause right here because this is a really good segue for us to open up the discussion. I'd like to have each panelist take 1 to 2 minutes to discuss animals being ground zero for infectious diseases and/or pandemics. And Dr. Mazet, I'd like to pass the torch to you to start the discussion.
Thank you so much, and thank you to Harris County Public Health. I've been watching you from afar from here in California and appreciating your approach and your proactive just force of good spirit and collaborative nature that are really making better outcomes for Harris County and are a model for the world. So thank you for that. I am a veterinarian. I'm also an epidemiologist working in public health. And I think it is critical to remember how interconnected we all are. Humans and animals, obviously with our pets, we're really connected. We think about things like rabies whenever we get our pet vaccinated. But it's also important to remember that it isn't the animal's fault that carries viruses. They evolve with their viruses just like we evolve with our viruses. And when they're evolving with us, they don't generally make us sick. But it's when human behavior puts us at risk because of how we're sort of using the planet that allows us to be exposed to viruses of animals. And so at home, our pets are also victims just like we are, but it is in general the way that humans are changing their interactions with animals that puts us at risk. And I'm happy to speak to you about coronaviruses and about the origins of coronaviruses, but I think it's important when we think about animals to just remember that the majority of viruses in veterinary medicine actually has recognized dozens of coronaviruses for decades as being really important, including remdesivir, the only drug that's licensed to treat COVID-19 right now, was developed with veterinarians for cats and their coronavirus disease. So we're so connected, we forget that, but I can speak to you about the hosts all over the world and the amazing people that have been working to identify the sources of these viruses that can be the next disease X or the next pandemic, as well as understanding how to get out of this big, terrible pandemic by understanding our animal hosts on the planet.
Thank you, Dr. Massette. Would Dr. Weaver or Dr. Moreno-Santillan comment, please?
Yeah, well, first of all, I want to thank to all the organizers for the invitation to this session. I am really excited to talk about this topic that today has taken a great importance, but not only within the community, the scientific community, but also with the general public. And I think we have to take advantage of that interest of people in this topic. So as it is in fact a really important topic to discuss, because the occurrence of zoonotic diseases is not something new or something unusual. Actually, the transmission of pathogens between species has existed since the beginning of the life's history. And this interaction of host pathogen interactions are one of the most important selective pressures among all living organisms. And this is pretty important because thanks to these interactions, we have developed unique adaptations that allow us to defend against these pathogens, like the immune system for us. However, today we're paying more attention to these events or to these emergency disease events because we have seen an increment on global outbreaks of emerging infectious disease. So, for example, so far in the 21st century, we have had at least 7 emergency disease events related to viruses. I'm not counting the ones of bacteria or fungi or parasites, only viruses. We have the West Nile virus, the SARS coronavirus in 2003, the MERS coronavirus in 2012, the influenza virus in 2009, for example, the Ebola outbreak, Zika virus in 2016, and now the current COVID-19 pandemic event. But why are we seeing this rapid increase lately? Well, it's largely a consequence of our anthropocentric events or anthropocentric actions, such as ecosystem disturbance, climate change, species trafficking, wildlife habitat invasion, and all of these factors have favored the appearance of these spillovers events. So even though these host pathogen interactions have been always existed, a successfully jump or a successfully infection from a pathogen to a new host is not that easy. We need a lot of really complicated biological and evolutionary process for a virus that is already adapted to his host to adapt to a new host. So it's not that easy, it's not that common, but with our actions, we are increasing this kind of risks in the nature.
I'd like to add my thanks as well to Dana and Harris County Public Health for the opportunity to participate today. Certainly a wonderful conference to have in our part of the country in Texas and the Houston, Galveston area. A little bit about my background and perspectives. I've worked most of my career on arboviruses and only the past 9 months on coronaviruses, like many virologists, especially those who have access to high containment laboratories like we have down here at UTMB. But arboviruses are all zoonotic viruses, and they're basically two kinds. There are those that remain zoonotic and only infect people via direct spillover from wildlife. And we have two good examples right here in the Houston area of those. The first one, known very well to everybody, I'm sure, in the audience, is West Nile virus, which arrived 2002, circulates every summer here in the Houston area. Fortunately, Harris County Public Health has a very advanced, sophisticated vector control program that undoubtedly makes a big difference in limiting human disease, but nevertheless, we have the avian mosquito cycle occurring every year. Very difficult to control these wildlife cycles involving mosquitoes and birds or rodents or other animals. And we continue to have human cases. Not a particularly bad year in 2020, fortunately, but some years can bring quite a few human cases. Another is Eastern equine encephalitis, also in our region, even more lethal than West Nile virus. About a third of people diagnosed with that virus succumb to the infection. That's also a mosquito avian virus. Only infects people, as far as we understand, by direct spillover when a vector mosquito bites a bird and then in a subsequent blood meal bites a human. But there are other kinds of arboviruses that also threaten us. They're not here every year, but they have been here in recent years and the past decade. And those are the arboviruses that have found a way to set up transmission cycles where they're completely relying on humans and mosquitoes. They leave behind the wild animal cycles where they originated. And the ones that we've dealt with in our area recently, of course, include Zika. It seems like a distant memory right now during the COVID pandemic, but we had an emergency situation in the United States with Zika only 3 or 4 years ago. Just before that, we had chikungunya. And we always have a risk from dengue coming from Latin America and Asia. And all three of those viruses have circulated recently in Houston and or South Texas. So those really exploit our behavior because just like coronaviruses, we transport them around the globe very quickly. We move their vectors around the globe through international commerce. And climate change is especially threatening for arboviral diseases because the vectors, being poikilothermic animals, respond more than many homeothermic animals to changes in temperature and can expand their distribution dramatically. So I think that in the midst of the COVID outbreak, we're not thinking a lot about arboviruses right now, but they certainly haven't gone away and they're going to be a threat to us for the foreseeable future.
Thank you all for your comments. I really do appreciate you all talking about just touching on the different types because it's a very diverse panel that we have. So, and here again, we have several people that are new to the One Health concept. So I'd like to take a deeper dive of what you guys were talking about how do those drivers you mentioned, ecosystems changed in climate change, mentioned deforestation. Could you all talk a little bit about how those drivers impact zoonotic diseases and the transmission from animals to humans?
Yeah, happy to. We have been working really hard across a broad consortium of partners in the US and in more than 35 countries around the world to address just that. And what we're finding is that the most important drivers for emerging infectious diseases, and I just want to reiterate what my colleagues said, that we are experiencing on the order of 3 emerging infectious diseases in people every single year. Now, Most of those don't hit the press, they don't cause a pandemic, but we are seeing new diseases in people. And all of the ones that have gone to large epidemics and pandemics have been those that have spilled over from animals, generally wildlife. So I think this topic is very pertinent. And those important drivers that are behind those spillover events are all linked to some very specific changes on the earth. And those are the drivers that also affect things like climate change that we just mentioned. So their human population density, how fast our human populations are growing, and then land use change, not just that land has become deforested, but the act of changing that land use. So as we convert large parcels of land around the world, we are disrupting the ecosystems that have come to equilibrium there. And we put everything, including the viruses and the people and the animals that carry the viruses, out of balance, and they're more likely to shed and also be susceptible to those viruses. So it's really connected, how we use the land, and I have a bug visiting me too, so sorry about waving there. But it is the population density, the biodiversity, so then the numbers and types of species we're interacting with, and then the land use change. And what we're finding is it's not, the most viruses aren't in the pristine, what people think of as the jungle. They're not in the urban centers, though that's where they can amplify and spread most effectively around the world. It is at that intermediate site where we are currently cutting down forests, making dams, making roads, changing habitat that we see these emergence events most frequently.
And for example, also with climate change, we have seen an increase of the distribution of, for example, mosquitoes that are an important vector for viruses. So places where we didn't find mosquitoes, we can find them now. And that is going to increase the risk of transmission. And also, for example, in the case of bats, we are starting to invade their habitat. So humans are starting to be in touch with bats more than before. And it's, for example, this is going to be a really simple analogy. If we want to compete a marathon, if we want to run a marathon, and I put a really high athlete like Usain Bolt, for example, and a person that doesn't practice any exercise at all, the one that has more possibility to win this marathon is going to be the athlete. This is the same with, for example, with us and bats. Bats has been exposed to viruses for almost, they have a history of evolution of 55 million years ago. And our history of evolution is from 6 million years. So you cannot compare how we have been adapted, we have been prepared to these viruses. So now that we have been in touch with these new species, we have been in touch with these new viruses, we don't know how to manage them. We don't know how to respond against them. So if we are invading their territory, we are increasing our risk of exposure. And also we are increasing their risk to exposure to our own viruses. Because the transmission is both sides, not only animals to humans, it can be also humans to animals, and that would be really dangerous for the biodiversity.
I'd just like to mention a couple other examples from the arboviruses for all of these same principles. If we think about last year before COVID, there was a lot of attention on this virus called Eastern equine encephalitis because it had caused more human disease than in at least 5 decades. And that doesn't mean a lot of human disease. There were about 50 cases. Fortunately, it doesn't infect a lot of people, but it's very deadly, so it gets attention. And there are some pretty clear reasons why this is happening. First of all, when the winters become warmer, like they clearly are in North America, the vector of that virus, which transmits it in the swamp habitat among birds, it can rebound its populations in the spring much more quickly, and it can build up its populations to the point where during the transmission season, when it's warm enough for the virus to replicate well in mosquitoes, it can get a big head start and achieve very high levels of bird to mosquito transmission in the swamps of East Texas or New England, for example. And so the virus is getting an earlier start. More of them are surviving over the winter with the warmer temperatures. And this means that there's more zoonotic transmission and more risk of spillover to people. And I think that's what we're seeing more of in the past decade, but especially last year. Another example of a way we change the habitat is a very close relative called Venezuelan equine encephalitis virus. That's a virus that also caused an outbreak here in Texas in 1971 when it spread the whole way up from Central America. And this is a virus that probably 500 years ago was simply infecting rodents and probably occasionally people living in Latin America and North and South America at that time. But in the absence of equids, horses, donkeys, mules, which were only re-imported into the Americas about 500 years ago, there were probably never any major outbreaks. But when people brought horses from Europe and the numbers of those animals for agriculture increased to a certain point, then they became very efficient amplifying hosts for this virus. So this is a virus that can jump from rodents to horses. And then in agricultural settings, horses are big mammals. They attract a lot of mosquitoes. They can be fantastic amplifying hosts. And then a lot of people get infected accidentally when a mosquito bites a horse, followed by a person later on. And the other factor is simply the huge growth of tropical cities around the world. If you think about the largest cities on the planet, they used to be places like New York. Now they're huge cities right in the middle of the tropics in South America and Southeast Asia, for example. And with those people in the tens of millions come along Aedes aegypti, a mosquito that's evolved to live in close association with people. That makes it a great vector for viruses like yellow fever, dengue, Zika, chikungunya. So it's not surprising that as these cities continue to expand and we face more challenges with mosquito control as they become resistant to insecticides, we're seeing more and more of these diseases. For example, the biggest outbreak of yellow fever in about 80 years in South America occurred just a couple of years ago. So a lot of these factors are converging to cause increases in the risk of these epidemics we're seeing.
Thank you. It was very insightful. It triggers a thought of how can we learn from the past? How can we look at the past and seeing those emerging threats from arboviral, from bats they get, we'll talk about this, bats they get a pretty bad rap sometimes, but how can we learn from that? And can we use that? The question is, can we use that to predict the next pandemic? Can we look at those trends?
Sure, I can go first, but certainly that's what the team that I've had the honor to lead has been working on for a long time. And I don't think we're going to get to the place where we're predicting, like the weather on Tuesday, high risk of Ebola on 3rd Street. That we're not going to get to that kind of forecasting just because of the complexities and because we haven't collected the data long enough to be able to do that. But we certainly already can predict the high risk interfaces. So the occupational roles that people play, for example, in Southeast Asia, it's becoming a very important economic occupation to harvest guano or poop from bats, bringing the bats to your farm and collecting their guano and putting it right on the food that's going into the food supply. So we can identify those high-risk interfaces and we can prepare communities to adjust their practices at those high-risk interfaces. We're already doing that. And Dr. Moreno-Santillan mentioned the markets. We know that moving animals and putting them in high concentrations with multiple species is another very high risk activity, moving them in stressful circumstances, and putting them in high densities with humans also in markets is a very high risk activity. Frankly, being a researcher like me and a veterinarian is a high-risk activity because we put ourselves in contact really frequently with all kinds of animals. And so we need to be thinking about PPE. I bet even the colleagues listening have noticed their own physicians starting to use gloves where they might not have before. There's so much that we can and should do. I guess my question is sort of back more philosophically is, will we learn? So we can learn from history. We have been learning from history. We've been learning real time. What we haven't had is the complete respect and collaboration of the scientific community and the public health community with the policy-making community. And I think that that is critical. We need to engender a collaborative and mutually respectful working relationship with government and science so that we don't get ourselves into this situation again. We need to be learning from the past, but looking forward and being ready.
I also would like to add that, yes, I agree, it's kind of hard to predict when is going to be the next pandemic event, for example. But it's pretty interesting that in January of 2019, there was a paper, it was a review paper about coronaviruses and bats. And one of the conclusions of the paper was, I hope the scientific community understand which are the gaps that we need to fill to understand the process of coevolution within bats and viruses, especially coronaviruses, to prevent future pandemic events. Unfortunately, the pandemic event arrives first than the knowledge. But I think it's pretty important, and that paper makes me think that we need to focus more our research to understand the processes of host pathogen interactions more than to predict future pandemic events, is to understand how this works and what can we do to mitigate or to decrease the possibilities to have these spillovers events. For example, the market trade. Unfortunately, some of these are cultural things, or there are things that people live from that. So maybe to put some regulations of how many animals they can have, or to test bats to see how incident is the viruses in that region. Because it is also true that not all bats are infected, or not all bats have the same viruses, for example. So to have a better understanding of these interactions can help us to mitigate the next pandemic events, or try to know how to respond faster to these events.
I'll go back to my favorite viruses, the arboviruses, for a couple of examples here that I think demonstrate both that we can do better in at least guiding our research to certain locations and certain areas, but we're never going to be able to completely predict these kind of outbreaks. And the examples I'll use are chikungunya and Zika viruses. Both arrived in the New World for the first time, at least in a century in the case of chikungunya, probably the first time ever for Zika. They caused these massive epidemics with millions of people infected, and of course, fatal outcomes in congenital cases for Zika, very severe chronic arthralgia with chikungunya. These are terrible diseases. We know based on our work in Africa that they both originated in zoonotic cycles involving non-human primates as important amplification hosts in forest environments. So I think one of the obvious conclusions is that we can be looking more carefully at primates, and especially in Africa and also in Southeast Asia, where dengue originated in the same kind of a cycle, to see if there are other viruses that we may have overlooked that may sometime in the future emerge. And Zika is a great example of a virus that was only discovered accidentally in 1947. It wasn't discovered because it caused human disease. It was discovered because scientists were looking for yellow fever by using sentinel monkeys in a forest. So there may be other viruses like Zika that we can find more easily now, thanks to next generation sequencing, for example, where we can find a needle in a haystack from animal samples through this technology. But on the other hand, the unpredictability is also demonstrated by our work on these viruses. In both cases, there have been emergences where the virus moved out of Africa into Asia a long time ago. In the case of Zika, it was circulating for many decades and almost silently. In the case of chikungunya, small outbreaks, but nothing like we've seen the last 15 years. And then suddenly the virus spreads to Southeast Asia and to the Americas and causes this explosive epidemics. And what we've learned is that some of this was predictable, but actually there's a lot of chance involved in whether and when this can happen. And in both of these viruses, when they spread from one location to another, they often undergo something we call founder effects, where they take with them chance mutations that reduce their ability to circulate efficiently. And in other times, they arrive with a very fit sequence, ready to start an outbreak at the first opportunity. And so this part of the emergence, the viral genetics, is subject to a lot of chance because RNA viruses, which are the majority of emerging viruses, undergo very high frequency of mutations. Those mutations are random. Sometimes they can help the virus to spread. Sometimes they can prevent it from spreading. And when they travel and start new point source outbreaks, they can carry either advantageous or deleterious mutations with them. And it's very hard to predict ahead of time what viruses are arriving with which kind. And in the case of Zika, we think this prevented the start of outbreaks for many decades, where the virus was just kind of smoldering in Asia, but not doing much. In the case of chikungunya, a new virus emerged in 2004 from Africa and spread very quickly halfway around the world and infected many millions of people. So there's a lot of chance involved, and the real challenge to making these predictions is that we'll probably never be able to predict entirely what kind of mutations have what effects on the virus until we do experiments. And of course, experiments take time and a lot of money.
Could I just bring that full circle, because we're all sitting here, we're scientists, we want to do more science, we want to learn more, and that's critically important to informing the future. But I just do want to say human nature plays a big role here, and our team over the last decade discovered more than 100 coronaviruses. We also characterized the risk of 77 known coronaviruses, so 177 coronaviruses. We've been waving the flag for a decade about how we should be ready for coronaviruses and be thinking about them and where they might emerge, specifically where they did emerge. And we weren't working in that area of China, so we didn't find the SARS-CoV-2 coronavirus, but we found many other SARS coronaviruses or SARS-related coronaviruses. And I think what we faced, even though we were well funded to do our work, was that on the response and preparedness and prevention side, people tend to look back. What just happened? We switch and we suddenly get everything ready for Ebola when we're worried about Ebola. We switch and we do everything for Zika when Zika's at our neighbor's door. We aren't yet using all of this information practically to look forward. And I think if there is a silver lining to be had of this terrible tragedy, is that we learn and adapt, and as people evolve from our nature to look back and be ready for what just happened and look forward. Because it's not just the coronaviruses, we've also found 900 other viruses of epidemic and pandemic potential that we should be thinking about. And some of those, just as Dr. Weaver said, need more experiments. We can do a lot with molecular work, but we do need to do additional work to understand receptor binding and how the host immune systems can overcome these things. But it is critically important that we work together to change our local, regional, and national and international mindset about how we need to be ready. We can have sort of pathogen agnostic plans for diagnostic pipelines, for vaccine pipelines, but we have to decide to do that and be ready.
Dr. Mazet, thank you for commenting on that. could you, and I'm pointing this question towards you, because we have a lot of lay people that are actually first timers for a One Health conference. Could you talk about how can the average person contribute to preventing the pandemics, or contribute to advancing the One Health concept?
Yeah, first, in everything we do, we have to be thinking about mutual respect and respecting the disciplines and the background of all of our colleagues while we work together. That's critical to the One Health concept. So it's absolutely about the interconnectedness of humans, animals, plants, and the environment, but it's also the second tenet that is so critical is coming together and getting all the experts to work together. So for a citizen at home, use your skills and your role in your community to make sure that people are recognizing this interconnectedness, that we start to work as communities to walk more gently on the earth so that we don't cause so much ecosystem disruption. And then consider, and I think the introductory remarks today help us really understand and focus on inequities. It is critical to be thinking about inequities in education that affect how we approach these issues, inequities in nutrition that affect how we might respond, and how different subsets of our population might respond. And then inequities on things like the most amazing first responders and essential workers that are completely dominated by our Black and Latinx populations that put them more at risk. And so I think every day we need to think about what matters, and we need to be working together with respect and taking control of conversations, speaking up, and working together to do things like get through it as a population, not just thinking about ourselves. So wearing masks, washing hands, just thinking about communicable diseases, not just now, but when this one's over.
Thank you. I have a question for Dr. Scott Weaver. So, and I'm saying that because of you associated with your research and with the Galveston National Lab as well. Could you tell us about the types of vaccines that are being developed, and will there be, do you know if there's going to be a vaccine for, I'm looking at some of the questions from the audience, for cats and dogs. So humans, cats and dogs, do you know, can you speak upon that?
Well, there are well over 200 vaccines under development for COVID-19 right now in various stages. The ones you hear about mostly in the news are the ones that are in the later stages of clinical trials. And for example, in our region, the 2 RNA vaccines are in clinical trials right in Houston and Galveston right now. You can participate in those. And there are 4 or 5 others that are also either close to or entering phase 3, which is the final stage of clinical trials before a license can be obtained from the Food and Drug Administration. So I think there's a very good chance that 1 or more of those vaccines will be shown to be effective, at least for a period of time. After they typically take 2 doses, and will be licensed perhaps by the end of this year or early next year. Of course, that doesn't mean that everybody's going to have access to those vaccines right away. The manufacturing pipeline is going to take time to be developed. There's already a head start on doing that. Unprecedented funds are being spent to basically build factories to make these vaccines before we even know if they're going to be effective or not. But that's necessary to keep the process moving quickly. So I think the big questions are, how long will immunity last? We already know that these vaccines induce neutralizing antibody responses in people from the earlier trials that we think are likely to offer some protection. But we know from monitoring people with natural infections that those antibody responses can wane very quickly in a matter of a few months. We don't know if that means that most people become resusceptible to infection a short time later. If they do become infected, if the disease tends to be less severe. There are a lot of questions that we won't answer until we follow infected people for many months or years. But I think these vaccines are likely to be effective at least for a short time period. There may be a need for frequent boosters for some or all of them. Some may provide longer lived immunity. Typically, live replicating virus vaccines tend to produce a little bit longer lived protection. For animals, I think that the same vaccines are likely to be just as effective in animals as in people. There may be some differences in the duration of immunity, but when they'll be available for animals, to be honest, I don't follow the veterinary vaccine work as closely. I think it's probably simpler to make a vaccine for animals than for people. The quality standards are not quite as high, but I think the emphasis is going to have to be on the human vaccines, and whether that's going to slow things down for veterinary vaccines, I don't know for sure, but maybe.
Thank you for commenting on the vaccines. I'm going to switch the focus a little bit and talk about bats. So this one is really directed to Dr. Moreno Santillan. So could you really talk about, I said earlier that bats, sometimes they get a bad rap because we think of all the bad things that they carry. Could you talk to us about, are bats beneficial to the environment, and if so, why?
Yeah, sure. Well, yeah, actually, they are more beneficial than dangerous for the. First of all, thanks to them, we have tequila. So that's why we have to preserve bats. That's the most important thing. They are pollinators. They have really, really good function as pollinators. From agave, from where we have tequila and mezcal, for example, just to have an example. Also, they are frugivorous, so they can help to spread seeds and recover forests. Also, bats are really important because most of them are insectivorous. So they are plague control, and plague control of most of these, for example, for mosquitoes. So they are plague control of vectors of another dangerous viruses. So bats are really important. Why we are saying that bats have a lot of viruses, and we are saying all these bad things about them? Well, I think a common mistake is that we think that bats are the same. Bats is just one species or one complex, but no. Bats are, we have 14,000 species of bats. 14,000 species of bats. No, sorry, 1,400 species of bats until today. And each one of these species is adapted to different environments. Some of them are insectivorous, some of them are frugivorous, nectarivorous. So all of them are exposed to different kinds of viruses. So like I mentioned before, they have been here in there since 55 million years ago. That's the evolutionary history of bats. And another important characteristic of them is that they fly. They are the only mammals that are capable of flying. So flying, it's the cost of flying, it's a high metabolic rate. So bats can have a lot of cell damage, and they have developed a lot of mechanisms to mitigate the cell damage. And actually, maybe this is the fact that they have been so successful to respond against viruses, especially to RNA viruses or intracellular pathogens. Because it turns out that the same mechanisms that they are using to mitigate this cell damage for flying, for these high metabolic rates, it turns out to be also beneficial to the response against viruses. And that's why they're saying that bats have a really, really good immune system. But it's, like I mentioned before, it's not that the 1,400 species of bats has the same viruses. Some bats are susceptible to viruses that maybe the old world bats are not. For example, Ebola or coronaviruses. We have to make more research about to know how bats are responding against all these different types of viruses. But no, the answer is not killing bats or blaming bats about this. It's not their fault that they have been in touch with these viruses and have developed adaptations through their evolutionary history that made them successful to overcome these infections. And we have to actually protect them, because if we lost the diversity of bats, we're going to have an increase of mosquitoes, for example, an increase of dengue, Zika, chikungunya diseases. We're going to lost a lot of the biodiversity in the world. The one is also using for as fertilizer. So yeah, we can have a lot of benefits from bats, and even from vampire bats, from where we have been able to find how to contribute to coagulation, to blood coagulation. So yeah, they have a lot of benefits for us, and killing them or attack them is going to be worse for us than than protect them. Mm-hmm.
Thank you, Dr. Moreno-Santillan. So Dr. Mazet, could you really talk to us about how can we get that One Health momentum move forward, the engagement part and the collaboration, communication, those 3 C's that we often hear about, so we can skip forward to the intervention part of it?
Yeah, so it varies if we're talking about locally in our own neighborhoods versus at the national level. And I think locally, I know we have many veterinarians and physicians and public health practitioners listening to us today. That's that we're one community. I think definitely reaching out and making sure we're working together, as your county has done internally inside public health, but I think doing that in our local communities is important as well. But on a larger scale, it is absolutely time to switch our thinking from reactive, where we just respond to what's happening to us, to proactive. And everyone can get involved with that by making sure that your legislators, your policymakers know that you want that as a community. I think making sure that we start to put our resources into understanding those threats and being ready for them is very important. And that does not mean taking away any resources from surveillance in the human population, but that means instead of having these huge amounts of costs going towards response, we spend some money, invest it ahead of time in identifying these viruses and putting into place actions for being ready. And I'm talking with USAID from across the world, because that's how we invest elsewhere. The National Institutes of Health have just started a whole new program with I think 7 centers around the country to do this kind of work. That I'm talking with the FDA and USDA about thinking about being ready and getting their pipelines for diagnostics ready ahead of time. Our Department of Defense is working on, among others, the pipelines for novel viruses for pathogens. That said, that's all kind of on the side. It's a niche thing, like, because there are scientists interested in it. We need the political will. We need the communities across the country to say, this is important to us. We need to be ready. And I can just give you the example. I'm working to start a momentum across the world with funders like the World Economic Forum and the G20 to really invest in finding all the viruses and putting that information in the hands of public health professionals around the world. We've done that with our predict viruses that we've identified. And I saw a question. There will be actually a publicly available website really soon where you can find all of the viruses that we've identified, and we've ranked them based on 40 different risk factors for their likely emergence. That's going to be called spillover. So look for that as that's coming out. But it will cost us about $1 billion to find the majority of the viruses out there that are available to us to become exposed and infect us, that can make us sick. That is, even if it cost us, let's say we search for every last rare one, we could do that for $4 billion. It cost us before this pandemic on the order of about $40 billion every time we had to respond to something like the first SARS, MERS, Ebola's. And so we're talking about 10% of a single response that we could spend over 10 years and find all the viruses and start to characterize and be ready for them, get them into the hands of the specialists like Dr. Weaver's been talking about to do the extra work. So it's a fraction of the cost of just one response. And now we're in the many trillions of dollars. So it's minuscule compared to this cost.
Thank you. That was very insightful. I really do appreciate you taking the time out and explaining it to us. So the next question is for anyone that feels like they want to just jump in. It's twofold. The participants, the audience, they want to know how the virus is transmitted. And I know that's a hard question. That's a complex question because there are different routes of transmission. So if somebody can talk about that, and then we can talk about the COVID-19 virus. And the question is, will it really ever go away, or will we learn to live with it like we've learned to live with the flu or H1N1?
I guess I can take a stab at that to begin, Dana. So the coronavirus, we're learning every day more about how it's transmitted. In the early stages of the outbreak, all we knew about this virus was that it was a fairly close relative of the first SARS coronavirus. And that was a much smaller outbreak. It did spread to some countries around the world, but the outbreak was ended in a matter of months with only thousands of cases. And it appeared that the first SARS coronavirus was mainly spread from people through either the respiratory route or through direct contact or fomites, objects that we touch repeatedly, but mainly through symptomatic people. In other words, if you just paid attention to screening at airports for people with fever, people who are ill, you could probably identify most of those people and isolate them and keep them from spreading the virus. And I think it's turned out that this SARS coronavirus is quite different in one way, and that's a lot of the spread is by asymptomatic people. And that makes it much more difficult to control because you can't just take people's temperatures every day, ask them how they're feeling. You've got to test people who are still feeling fine, who may never develop symptoms or may develop them a day or two later. And the thinking now is based on the epidemiology and also experimental work that we've done here and other places, that this virus survives very well in very tiny particles that form aerosols that we're breathing out constantly, especially when we speak loudly or we sing, where we've seen super spreader events. And probably airborne transmission is more important than direct contact or fomites for the largest number of people becoming infected. Would you like someone else to take the second half of the question, or?
I would like just also to add regarding the viral spread, that for a virus to be successful spread, we need three things. One, that the virus can actually find a host, that the cell has a receptor, so the virus can enter to the cell. That's the first barrier that the virus has to overcome to spread. And then to overcome the immune system of the host. Like I mentioned at the beginning, it's not that easy for a virus to jump to another host. We need to, it needs to overcome this, at least these two barriers, to find a good receptor and to fight against or to be invisible to the immune system of the host.
To get back to the second part of the question, will this virus be around indefinitely? I think if we look at other respiratory viruses with different levels of transmission efficiency, on the one end of the scale is measles virus. It's one of the most transmissible viruses we know of. much more transmissible than SARS coronavirus 2 or 1. And that virus, we still have not eradicated despite having a very effective vaccine for several decades. And we managed to suppress spread of that virus by vaccinating about 95% of the people in the United States. When we drop below that level, we start to see outbreaks, regional outbreaks, like we have in recent years because people decide they don't want to vaccinate their children. And now the SARS coronavirus 2 is not quite as efficiently transmitted, but if you extrapolate what we've learned from other respiratory infections and the efficiency of transmission, we usually express in a value called R sub naught, which is the number of secondary cases that each infected person produces through spread. We can probably assume that we would need to vaccinate or have herd immunity in the population around the world of probably well upwards of 75% before the transmission would become so efficient that the virus might go extinct, like smallpox did, for example, through vaccination. So can we ever achieve this very high level of vaccination for this virus? I think it's possible, but not likely, at least for several years. The reason is that we still don't have a vaccine approved. Making enough for the entire global population would be very tough. A lot of people right now don't trust vaccines, especially for coronaviruses, the new ones. So it's going to be a huge challenge. And the other thing is that if immunity is very short-lived, like we suspect it may be, that means we would have to boost people very frequently with such a vaccine. Fortunately for measles, the vaccine that we use is live attenuated and it produces immunity that lasts for many decades, if not for life. And that makes it much easier to achieve those levels of immunity through vaccination. So I think the short answer to your question is, theoretically, it might be possible in the future to eradicate this virus, but it will be very difficult, and I think it will take a very long time.
And maybe just to top up, even if we eradicate this one, we won't eradicate what we're doing to cause what caused this one and will cause the next one. So we still need to be vigilant and to be working towards reducing those drivers and their influences that allow us to have these viruses. So the risks will still be there. I'm not trying to be inflammatory or scare people, but we need to consider how we treat the earth to stop climate change and the acceleration of the risks that we have from these viruses.
Thank you. Thank you for your comments. So now we're taking questions from the audience. And there's one that's pretty interesting. They talk about wet markets are probably not unique to China, and that we probably have several of them in our areas or regions throughout the world and here in Texas. Is there any reason you can think about regarding the origin from this one and the previous SARS?
I don't see you. Oh, Dr. Weaver, did you want to answer? Or I can jump in.
Well, I can take a crack if you wish. I mean, during the first SARS outbreak, there was almost a smoking gun about where that virus came from. It was detected in animals in local markets in China around the same time that people started becoming infected in animals called civets that were sold as food live in the market. Ultimately, we still think that that virus came from bats, and exactly how it transitioned from a bat to a civet, that's not completely understood. Whether it had to somehow adapt to the civets, possibly that happened as well. There was also some evidence that the virus adapted through mutations to more efficient spread from human to human. And we're just starting to see that now with the SARS coronavirus 2. There's going to be work coming out next week showing that one particular mutation allows the virus to replicate more efficiently in the upper airway of animal models, and that we think leads to more efficient spread, and that's a mutation that's been spreading around the world. But for the SARS coronavirus 2, there's not really a smoking gun. As Dr. Mazet said earlier, there have been sampling of bats in various places around the world, including in China. There have been viruses identified in bats that are fairly similar to this. They differ by about 4% in their genetic sequences. That doesn't sound like very much, but that probably translates into viruses that diverged evolutionarily at least many decades ago, not last year or 2 years ago or something like that. So there's probably a virus out there somewhere in a bat that has not been sampled that represents the direct ancestor and the source of this outbreak. But again, as Dr. Mazet said, we need to continue the surveillance. Unfortunately, the program that was sampling these viruses in China for many years was shut down earlier this year. The NIH had been funding that work, and that was terminated without scientific reasons being provided. So I think the surveillance, the continued surveillance is critical. As Dr. Mazet eloquently put it, we can spend a lot less money to find everything that's out there than to wait and try to control the next outbreak. And that's certainly the case with these coronaviruses. And at least we have a good idea that most of them that are the biggest threats, we can focus at least on bats.
Yeah, with our work, again, the PREDICT project, which also just ended, by the way, in September 30th, that we were doing this work all over the world. We did identify in China an increasing risk of coronaviruses as animals were kept in high densities and mixed species, just like the first SARS. In Vietnam, we had a very interesting finding and outcome that was just published this year, that rodents in that human food chain trade, all the way from being collected in the field, so where hunters and trappers were finding rodents in Vietnam, about 21% of those rodents were infected with coronaviruses that were available to spill over. Not all of them could make people sick. We don't know which ones. That's why we need to do more work. By the time that there were in a large market, 32% of the rodents sampled had coronaviruses. And actually, and most disturbingly, by the time they got to restaurants where they serve rodents, 56% of the rodents were positive and available for exposure of the people who work in the restaurant as well as the people eating in the restaurant. So, so it certainly is true that risk is amplified and concentrated along this human value chain, food value chain.
Thank you. We're getting several questions from the audience. Here's one about, what are your thoughts about health screening for travel for humans and pets?
Well, I think that's something of the most important thing that we have to do in order to contain or to mitigate these pandemics. I mean, I know it's going to be expensive, but if you think about the costs of not doing that are greater than if we spend some resources to actually test people that come from a place from high risk of infection. So this certainly is a good strategy to mitigate or to decrease these effects of viral spread.
Okay, thank you.
I'd like to just add a little bit to that. I think it's important for all of us to recognize that once things get back to normal, if we ever see the same normal, and there is a lot of international travel, we need to think carefully about where we're going and what our risks of exposure may be. And just by way of example, again, back to my favorite arboviruses, if you're traveling to a major city in Latin America or South or Southeast Asia, and you're not in some kind of very well protected place where mosquitoes don't have access to you, you're going to be at high risk of becoming infected by dengue virus, maybe chikungunya or Zika virus as well. If you return to a place like South Texas or South Florida or even the Houston area, we have all the ingredients here for you to start a new outbreak of that same virus. We have Aedes aegypti mosquitoes. We have almost the entire population susceptible, naive, without immunity to that virus. And the more challenges we have to controlling mosquitoes due to insecticide resistance and other things, the greater that risk is going to grow. So we have to think when we travel that we may be the person who brings the virus back with us, and we don't want to end up in a place where we're getting bitten by lots of Aedes aegypti when we're starting to feel ill, but we're not connecting the dots that maybe I have dengue or maybe I have chikungunya. We're just thinking, oh, maybe I ate something bad during my trip or on the airplane. And if we go even to a clinic for diagnosis, we need to remember to report our travel history, and our caregivers need to think that our travel history might have a lot to do with our disease. And what could that be? Could it be something that we could initiate spread of an arbovirus or something else? So we can take personal responsibility, try to protect ourselves from mosquitoes if we're in an endemic area. And then when we return, if we become ill, think very carefully about what it might be and report that when we seek clinical care.
As a public health practitioner, I thank you for that response, because that was educating the public, and that's a message that we send often. We have a couple of more minutes left. There's lots of talk about reverse zoonosis in the chat box, and so they're concerned with, they want to know, are we concerned with the evolution of SARS-CoV-2 in animal population?
Yeah, certainly. I mean, we know that that many animals have the same receptor we do, the ACE2 receptor that SARS coronavirus 2 uses to enter cells, and then different animals have different sort of immune responses once that enters the cell. So for example, people like me who work with bats we currently are observing a moratorium where we're not working with bats because we don't want humans to infect the bat populations here. Also, I think that, and there were some questions that kind of scrolled by as I was distractedly looking over at the chat box, but it's really us that's going to infect the animal populations at this point. Now, certainly where the evolutionary host lives, probably in China, probably in the Hubei province, that there's opportunity for additional spillovers into other animal populations and back into people. But for the rest of the world, it's the humans now that are the source and infecting cats and dogs and other species. And most of those species don't have very bad outcomes. Cats a little worse than some of the other species. But again, if we think of our pets as members of our family, and we don't want to infect other members in our household, so we isolate ourselves from them, we want to isolate ourselves from our pets as well. If you can't do that, then make sure your pets aren't interacting with other people and other pets if you have COVID in your house. So it's really, it's less terrible outcomes for the animals right now, but we don't want to put them at risk or any other wildlife species at risk that might become a viable reservoir for the future.
And also, I would like to add that there's a recent study that they tried to figure out how some mammals are susceptible to infection of SARS-CoV-2. By doing this, they analyzed the ACE2 protein, that is the receptor from this virus in humans. That it's a normal protein in all of us. It actually regulates blood pressure. And they find out by comparing the genes of this ACE2 protein in many mammals, they can actually make a prediction of which mammals are at high risk of getting infected by coronavirus, medium risk, lower risk, and very low risk. And it turns out that the ones that higher risk are all primates. And cats, for example, and dogs, that are the ones that we care about because it's our pets. It's like cats has medium risk of being susceptible to SARS-CoV-2, and dogs have a low risk. So yeah, the efforts to understand how SARS-CoV-2 can actually affect other species and other mammals it's going on, and it's something really important to understand to prevent more more tragic events of this outcome.
Thank you so much for your comments. We have exactly 1 minute, and I'd like to give you all the opportunity to do your 15-second elevator speech to close us out.
Well, it's time to think differently. It's time to think proactively, be ready for these things, and then take personal responsibility, get your vaccines, be a citizen of this earth, and recognize you're part of a huge community, and that together we can get through this, but we have to think about each other, not just ourselves.
I think we also need to communicate effectively with our political leaders about the importance of science in getting us through this outbreak and in preventing the next one from coming along. We know a lot of strategies that can reduce this risk, but we need to have the right funding in place, and we need to pay attention to the science.
Yeah, I would say that yes, we are indeed responsible participants, but we also have the power to mitigate them. As a species, we have the advantage of being rational species. This is what distinguishes us from the wild animals. So we must take advantage of this. If we don't take this opportunity that the pandemic is giving us to develop better conservation strategies, to increase our knowledge, and most importantly, to listen to the scientific community, we will see these types of events with greater frequency and greater severity too.
This has been a very healthy, beneficial, informative. It was a history lesson, brought me back to Virology 101. So it was a very good discussion. I think we've recruited some One Health members. I think we've recruited some public health and some virologists and scientists and some evolutionary backed interest people. So thank you so much for your taking the time out and for just your subject matter expertise and sharing it with our audience. So thank you. We're going to take a 7-minute intermission so we can transition speakers to the next session. I don't want you to go far away because we have another powerhouse session to start soon. Thank you.